For this year's IHI Forum keynote with Brandon Stanton, creator of the popular website Humans of New York, we ask you, the IHI community, to share and nominate frontline healthcare workers who are doing extraordinary things. During Brandon's keynote, you will hear from 3 incredible individuals. However, we were overwhelmed with the stories and nominations we received and had a hard time picking just 3 to share. Therefore, we put together this short video clip that highlights just a few of the other courageous, dedicated, and hard-working people you told us about.
The global pandemic has prioritized the need for innovative virtual care models, and the National Association of Community Health Centers and its Quality Center is delivering solutions.
This COVID thing's not going anywhere, it seems, and we need to continue to help our patients with chronic disease, with tools that we can give them.
In Zoom-Fall, the program helped us stay connected to our patients.
Having that guidebook was helpful, but I also didn't feel restrained by it.
So that was really exciting to see, where it was like they feel like this changed their health outcomes.
I feel the program helped us stay connected to our patients, especially during this time of COVID. We're able to provide continuity and supportive care and help our patients with their condition from the safety of their home.
At IHI Community Health, our care managers were able to stay connected virtually while also gaining a fresh perspective into the lives of their patients.
Start, we had 35% say they had poor health and only 6% say they had poor health at the end.
Whoa, this is awesome.
Despite the negative impacts of COVID, it really has taught us many things, but we need to keep learning and we need to change our practice in healthcare. With the onset of COVID came the dreadful visitor restrictions. The importance of connecting loved ones in the hospital with their families and support persons has always been on the radar of healthcare providers. However, we have been successful at unintentionally leaving them out. We failed to replace their presence with a phone call, with any structured or concrete expectations that will ensure families receive the medical updates and connections that they're so longing to have. I can't imagine having a loved one in the hospital, sitting at home, anxiously waiting for any information, any update, any connection. Families have been robbed of the opportunity to be at the bedside, where they can no longer be the advocate, and they can no longer tell us everything we need to know to take the best care of their loved ones that we can. The healthcare system needs to keep learning. We need to spend time and resources at ensuring these valuable team members are brought back to the center of what we do.
Hello, my name is Joe and I'm a nurse. And during the COVID pandemic, I was redeployed to work on the intensive care. On a daily basis, I went from joy to grief and grief to joy in a matter of seconds. It has been a roller coaster: anxiety, fear, insecurity, guilt, anger, loneliness, and also you realize your own mortality. After a year, I became very tired physically and emotionally, tired of the pain on the phone, tired of the daily tears, tired of the loneliness, the broken life, that seeing people dying every day, tired of waking up in the middle of the night, tired of having nightmares, dreaming of the terror in my patients' eyes and their tears running down their cheeks. I was tired of saying goodbye, because they are not numbers. Each one of them leave a scar into my heart, and I'm not ashamed to say that I needed help. Mental health is like physical health. You must take care of it every day. As with love, so with stress and anger, if you don't deal with it, it goes wrong. I have learned that I'm no less of a man or a worse father or a worse nurse because I had mental health problems. Taking care of your mental health is not a weakness, quite the opposite. The bravest thing that anyone can do is ask for help if they need it. It's okay not to be okay. Please take care of your mental health. Pass it on. Thank you.
I have learned over the last 2 years that we must partner and come alongside one another as fellow human beings with love, compassion, and presence. More than ever, I have seen our teams connecting with one another in their stories, recognizing that we have all experienced loss, grief, and some joys over the last 2 years. And as funny as it may sound, I have discovered the power of Dove dark chocolate. When sprinkled with presence, gratitude, and love, as we have walked around our hospitals on rounds simply to say, I see you and the work you do, and I appreciate you. The last 2 years have been overwhelming emotionally and physically for our teams. And yet, I am in awe of the teamwork, love, compassion, and gratitude shining through that darkness every single day.
Hello, I'm Dr. Tom McCarrick. I'm a family physician in Northern New Jersey. I'm Chief Medical Officer at Vanguard Medical Group. We have 10 offices in New Jersey, taking care of about 60,000 patients. We learned many things. This was like getting thrown into the deep end of the pool. We learned that prioritizing safety was critical to keeping our providers and staff working and caring for patients. We learned that frequent, regular, and clear communications with staff and patients were very much appreciated. We learned that patients do trust their primary care doctors, and that in the midst of a lot of misinformation in the media, that the patients trusted what we were telling them and relied on what we were telling them. We also learned to be better teammates. We distributed leadership across the organization and learned that there were many talents inside Vanguard that we were able to leverage at that time to take care of our patients, and now that has become part of our core strength.
Thank you to all who submitted nominations and to those who were nominated for your incredible work. We truly appreciate and admire all of you. Tune in to Brandon Stanton's keynote at the 2021 IHI Forum for engaging and eye-opening conversations between Brandon and 3 of your remarkable healthcare colleagues.